And welcome to the Aged Care Industry Information Technology Council National Forum, incorporating the National Home Care Group and the CIO's Forum. We'll just give people a few minutes to join in. Whilst we do that, we'll go through some basic housekeeping. Today's forum is part of our quarterly national forums hosted by the Aged Care Industry Information Technology Council. See, the numbers are starting to build up, so we'll kick on. I would like to begin by acknowledging the traditional custodians of the land on which we each gather at today and pay my respects to their elders, past and present. I extend that respect to Aboriginal and Torres Strait Islander people who have joined us today for this event. For those of you who don't know me, my name is George Margellis, and I am the Independent Chair of the Australian Aged Care Industry Information Technology Council, and I will be your Master of Ceremonies for today's event. Before we move on, we'll start off with a few housekeeping items. All of your microphones have been muted by the event manager for recording. So don't try to talk to me because I won't be able to hear you. However, if you do wish to ask questions at any time, please submit your questions on the Q&A panel available on your Zoom screen. It's usually down the bottom of your screen. If you can't see it, you may need to hover your mouse around the bottom of the screen. And there's a Q&A panel and a chat panel. If you have any specific questions, we request that you please use the Q&A panel. That'll be managed by a number of us to make sure your questions are answered. Any questions not answered during today's session will be answered offline and made available via the ACIITC.com.au website. This session is being recorded and will be made available in a few days, again, via our website. During the event, you will be asked a number of poll questions. We will ask all attendees to vote on these where possible, and keep in mind that all results are anonymous. We don't know whose votes for each item, so feel free to be open and honest with us around the polls. If you have any inquiries or need any technical support, please submit them through the Q&A panel, and our secretariat, Georgie, who's in the background there managing this, will handle those for you. So just a reminder, if you have any questions, please use the Q&A panel during the presentations, and all questions will be collated, and we will have a session at the end of the presentations to answer your questions and have some discussion. If you have any technical issues, please also raise them through the Q&A panel, and our secretariat, Georgie, will help you as much as she can. So, this is a bit of an overview of what we're about to talk about today. We've got quite a full session, but we have left quite a lot of time at the end for Q&A and discussion. So please, as I pointed out earlier, any questions you have, pop them into the Q&A panel as soon as they come to mind. We will be managing those questions in the background, and we'll be answering as many as we can at the end of the session. Just for those of you who don't know about the Aged Care Industry Information Technology Council, for brevity, from now on, I will be calling it the Council because I'm going to get very tongue-tied trying to manage that word, those many words over and over. Next. First, let me introduce you to the board and our various committee chairs. So as you can see, I'm the independent chair, and we have two representatives from each of the peak bodies who are the co-owners of the organization, Janine Buckley and Derek Dietrich from ACSA, and George Andriola and Brendan Moore from LASA, and all of those comprise the main board. We also have three committees which are very active, and the three committee chairs will be with us today during our event. Rod Young, who chairs the ITAC committee, Gavin Tomlins, who chairs the CIO Forum, and Anne Livingston, who chairs the National Home Care Group. And most of you will also know that Anne also acts as our Executive Director and is a point of contact for most times. So, right, the Council has been active since 2007 when it was formed by the then two peak bodies, ACSA and ACCA, and ACCA later became LASA. At the time, a number of us identified the need for the aged care sector to embrace technology as a key enabler to prepare for the massive demographic, social, and economic changes ahead as the baby boomer generation, of which I'm proud to be one, reached maturity. The group was formed to assist the provider community to provide high quality care whilst ensuring their sustainability. This involved bringing providers, consumers, suppliers, payers, and regulators together to design a system which supported innovation. Early on, we identified the important role of the vendor community played in developing, introducing, and implementing technologies in the sector. One of our early programs was ACIITC, the Aged Care Industry Vendor Association, to facilitate communication within the sector. From the outset, we were supported by the vendor industry, and we appreciate their support. Over the years, whilst running the ACIITC conference, we have provided a forum for vendors and providers to interact, and we believe this has been quite successful. Moving forward to 2020, we have been pretty busy, and you'll hear more about that from my colleagues Anne Livingston and Gavin Tomlins. However, we cannot rest on our laurels. One thing our work has shown is the need for accelerated innovation in our sector to meet the huge unmet demand for high quality, safe, effective services for older Australians. It is our belief that digitally enabled services are the key to delivering on this need. This should be our moonshot program. The aim for today is to grow the collaborative ecosystem, which has been the basis for our industry's success to date, and to take it forward. The COVID crisis has been an impetus for adoption of technology across the sector. As we move into a new normal, we believe the opportunities for collaboration and innovation are great. To do that, we need your input. We have left a big slab of time at the end of the event to get your feedback, answer your questions, and develop a plan for going forward. Please enter your comments, questions, and suggestions into the Q&A box, and we will discuss them at the end. This is the first of what we plan to be an ongoing dialogue by the whole sector with the goal of developing a vibrant, innovative local solution industry whilst ensuring and improving the quality and sustainability of our aged care provider industry. We believe this is not just a post-COVID opportunity, even though that is an important imperative. At the Council, we have highlighted from the outset the challenge Australia faces meeting the predictable demographic changes we all knew were coming. This current crisis has put them firmly in the country's focus. We need to now work together to help solve them and ensure our industry's viability. Together, we have the opportunity to enhance the care of older Australians whilst also developing a strong aged care technology sector with local and global growth opportunities. We at the Council look forward to working with you to deliver on that promise. As you can see there, there's some recent projects we've been involved with. And to go into more detail about those, I'd like to first introduce our first speaker, Anne Livingston, who's the chair of the National Home Care Group, the Council Executive Director, and also Director of Global Community Resourcing. Please welcome Anne Livingston.
Thanks, George. Just a few technical issues in the background there. Thanks for that introduction, George. It's my role to just take you through some of the work that we've been involved in the past, and to highlight the work that we've just completed, and to give you a summary of some of those findings. So many of you would know that the Council has, from 2012, invested in a range of research activities. Some of you will remember our first undertaking we did in 2013, where we detailed what a digital care service landscape might look like. We had great support for that and launched that at Parliament House. We also then in 2017, in direct response to the Sector Committee on Ageing roadmap for aged care, where the concentration wasn't on technology and innovation, and we felt it was important to put that lens on the work that the Sector Committee had done, and to really focus in on the role that innovation and technology could play in the landscape of service delivery. Accompanying that, in late December 2019, we released what really is a gap analysis between the work that we did in the roadmap and the literature review from 2016 to 2019. This piece of work is a really important piece of work in that it looks at what the evidence is directly telling us about what works and what achieves impacts for older people. It's a really essential read for service providers and vendors alike, so I'd encourage you to download any of those documents off our website. We have been tracking how those documents are used, and we know that for a piece of research that the two documents are highly accessed in the academic world, but we know also that service providers are utilising these reports to inform their strategic direction, map out and benchmark what they're doing against what the evidence is showing. But many of you would be interested at this time of really a critical time in the industry. You know, we're seeing significant challenges globally and nationally, not just because of COVID, but because of a number of pressures that we all know that are on the sector. And we know that at no time in history has the importance of innovation and technology been at the forefront. So I'm going to turn and talk particularly about the CARE Innovation Technology Project. Some of you who've joined us in other national forums that we've held would know that we were funded by the Department of Health to undertake a 3-month project which concluded in June this year. Really a 3-month project that should have probably been a 2-year project. We were contracted to do an environmental scan of both what the literature was telling us, but also what the industry was telling us about what technology was being adopted, what innovation was being pursued, and what barriers and success stories they were. Some of you were involved in the 2 high-level industry consultations that we held. We also set up a number of reference groups, and I'd like to thank those individuals who joined those reference groups. And we provided on the 24th of June our final report to the Department of Health. So our research did find many significant innovations happening in the sector. But we also found that these were not widespread, and that many of the examples of innovation could be mainstreamed and should be mainstreamed. We found many examples of leadership in this area, and those leadership, we believe, should be highlighted and recognised for their contribution. Through the report, we've identified many success stories and what has helped those success stories happen. I think it's 414 pages of reading and research, but we also identified many barriers that were occurring and stopping the uptake. It's important to reflect on the numbers in this research. In the 3-month period, or probably the 2.5 that we had to actually go out in the field, we had 421 participants in the various surveys, but it's important to note how highly representative these participants were. They represented some 661,000 consumers, a workforce of nearly 92,000, and also a voluntary workforce of over 21,000. It's important to note that we identified 420 different vendors, and many of those were new to us, so we could see a really emerging new set of vendors coming into the sector over the past couple of years. In terms of how representative our sample was, the smallest provider that participated had 2 clients, and they were a fairly established provider who was contained in a geographical area, only providing a single service set. To the largest provider who had nearly 87,000 individuals that they serviced across a range of aged care service provision, in fact, across every aged care service provision. We were really pleased that we did get responses from every geographical area, and we really did use our networks as much as we could to ensure that we got places like the Northern Territory and Tasmania in our survey set. We looked specifically at 5 issues, and I'm going to go through some of the high-level key findings. Those 5 areas included business and administrative systems. Important for us is the B2G reporting and online access to government. We looked specifically at surveillance and monitoring, telehealth and telecare, and those broadly defined technologies that assist people to stay safer in their own homes, wherever that might be, through a broad definition of smart home applications. I guess it's important to note that this research was not contextualised in COVID. We were funded and commenced just as COVID was taking over. So we were funded on the 13th of March, and we started the research around the 15th of March, so very early in the COVID period. So like many, we diverted our attention to COVID and the needs, and particularly the net effect that it had on telehealth and telecare technologies, and their introduction and widespread usage with the Prime Minister's announcement of universal telehealth coverage. But we do make a number of findings in the report, particularly around what is going to happen post September 2020, when the Medicare telehealth items might be up for review. We did realise and recognise that there are a number of implementation issues that were consistent, and that there was a real need to look at workflows, standards and systems to allow this to be universally used in both residential and community care. We did find some best usage case examples, and we've highlighted those in the report. We've also highlighted that there needs to be much more work done in conjunction with vendors around return on investment for products. We saw some early work from some providers around indicating the value of this approach, and we also obviously saw the value of this approach when people were isolated in facilities or in their own home. Integrations were important, and the need to improve those integrations across a number of other technologies that are used in the care system. But we also found that there is a body of research that is showing that older people are really positive about the use of telehealth and telecare, and that we as an industry could capitalise more on that appetite that older people and their families present. We then looked at smart home technologies, and we found a number of barriers, including cost, usability, privacy and security, and reliability of equipment. These barriers were, I think, affecting the uptake of smart home technology in the sector, and we've made a number of recommendations about how we might improve that. One of the interesting areas for us was the systems reporting, and we found a number of issues in terms of the amount of time, the energy, the resources that people were putting into reporting, and I know that Gavin's going to go in depth in those in his report. But we did find a clear divide between organisations that are showing a high level of digital maturity and those that are struggling. And it's this divide that I think the council needs to work actively in the next couple of years to close that gap. We found significant issues around adoption, but we found some very good examples of high levels of adoption that were providing better quality of care, more reliable service delivery, more accountant accountability in the service provision, and indeed that we found a number of issues that were interesting about how technology is being used to monitor staff and consumers. But we did find some problems, and they are really related, I guess, concern for us in a consumer-directed environment and landscape of service delivery, that consumers had very little access to systems, their own records, and were really not at the forefront of control of innovation and technology in their service package. We found poor system security, and this is an area that we want to concentrate on the next couple of years. And we found that there's a universal need to improve the awareness and education across the sector, across levels of care, and across levels within organisations. In terms of the government reporting finding, we found that over 50% of respondents were spending between 6 and 101 hours of reporting, and this was particularly in respect to DEX reporting. We found a number of issues around government reporting, which may not surprise anyone on today's link, and we're working actively with the department about improving some of this, particularly about streamlining the reporting and looking at standardised processes to support this. We also look specifically at surveillance and technology, and particularly the technology used by aged care providers to look at a number of things around monitoring and surveillance. So we found that in terms of passive monitoring, that 51% of the sector indicated they weren't using any of the new technologies, particularly those such as sensor-based technologies. We found that 54% of the sector were not using nurse call data analytics to understand the patterns of demand and usage. We also found that there was a poor level of consumer record integration. Again, this is probably a lot more work, indicating a lot more work can be done in this area, with 86% of respondents not using or not having any consumer record integration. And we found that 44% of individuals were not using GPS tracking, and we also had a number of responses that didn't understand the application of GPS monitoring and the opportunities that provides. So our survey only indicated less than 30% using GPS monitoring, and predominantly that was to monitor their staff. So what's ahead of us next? We're doing a number of national forums. We're going to work with the Department of Health to hopefully in the near future release the report in its entirety. We're also building on this body of work and drilling down on other research activities. We've got a number of strategic alliances with the Digital Health CRC, the Digital Health Agency, and other entities. And we hope to work collaboratively with many of them to provide some more research activities on the back of this report. We're working actively and collaboratively with the Department of Health, considering our 9 recommendations. We thank the department for the positive nature in which they're looking at these recommendations. And we know that the department has already shared this report with the Royal Commission, and we're working actively where we can with the Royal Commission to provide updates and provide other material around the work that we do within our forums and within the research. So thanks, George. Hopefully that's provided an overview of this work, and I'll hand back to you. Thank you, George.
Thank you, Anne, and thank you for covering what was a very comprehensive report in a short time. Keep in mind, everyone, there is a lot more detail in the report, and our goal is to release that report publicly in the near future. But if you have any specific questions about it, now's your chance to ask those questions using the Q&A panel. And we're not limiting ourselves to questions. If you have any comments, any statements you'd like to make, please feel free to enter those into the Q&A panel, and we look forward to a hearty discussion at the end of the session. Next, I'd like to introduce Gavin Tomlin. So Gavin is the chair of the National CIO Forum, and Gavin's going to be looking at the recent project from the vendor's experience. Welcome, Gavin.
Thanks, George. Good morning, all. My role this morning is just to go through briefly and go over some of the findings from the vendor research project. So obviously there's two surveys, the industry survey and that of the vendor survey. As Anne alluded, the council thanks all those vendors who took time out of their busy schedule and provided resources. We had a lot of positive feedback. As was identified, there's 139 vendors who partook in the survey, and that identified 420 vendor solutions. There's the full gamut of vendors. We had people with like two-man operations up to organisations with 1,000+ employees, also covering those who are new to the industry, the startups, with some vendor partners being in the industry for the last 50 years. As Anne alluded, there are a number of innovative solutions being provided by vendors, and when we cross-reference that back to the industry survey, there's opportunity there basically to educate and maybe work with the council to better promote those uses of those innovative solutions. Next slide, please, Georgie. Similar to the uptake of the the industry survey, it was pleasing to see that the vendors are covering all of Australia, covering regional, remote and metro, and their various service deliveries. So that was pleasing to see, so across the board. Next survey, Georgie, please. And as was sort of expected, there's the full gamut of services being covered, those covering residential aged care, home care services. And the industry, the vendor survey also endeavoured to look at who's moving into the NDI space. So there was a holistic coverage. Here's areas of opportunity for the council and the vendors and service providers to work together. From those innovative solutions, a number of vendors basically saying that there's a lack of readiness from the service provider to be able to uptake those particular solutions. And also there seems to be either a lack of financial incentives or consumer readiness to basically take the technologies on board. So there are a number of solutions that are available to industry at the moment, which we believe can penetrate and further assist the aged care industry at this point in time. Next slide. Part of the survey is also, we wish to have a look at around privacy and data. We believe there's some work to be done there. So we did delve down into who actually owns the consumer record at this present point in time and how that data is being used. Some organisations did indicate that data is being used with consent from consumers to do big data mining. We're also concerned around the privacy because there seemed to be a bit of a disconnect between the industry survey with service providers and their security and privacy. A lot of the service providers actually indicated the role of the vendor as being their guardian or being their person to basically provide guidance around data and privacy at this present point in time. We also wanted to investigate, especially with the new emerging technology solutions like software as a service, what actually happens on the termination of the contract. It was important to see that there was like agreed arrangements in place where the clients and the notice will hand over the information together, and that there were some destruction data processes in place, but the industry and the council believe that there is some improvement to be made there. What was positive to see is 91% of the vendor respondents basically indicated that they had 1 to 50 systems that their current systems do integrate with. Again, I believe that there is an opportunity for education around that particular integration piece. As Anne indicated, one of the areas that we did look around was the business administration and information capabilities. 35% of the vendor organisations indicated that they do provide a mobile phone or a smart device type situation. We did actually also delve down into what broadcast technology solutions were available given the COVID situation. So we saw that there's only 24% of vendors currently offering vendor solutions to the service provider. That was also reflective in the industry's solution, as well as the means and mechanisms to be able to distribute and broadcast messaging. So there may be opportunity. As Anne alluded, the security and protection is of concern for the council and for the industry. 33% of the vendor organisations did report that they do provide two-factor authentication and firewall protections, but overall the uptake with the service provider and in the industry, we believe that's an area that could be improved upon. Thank you. Next slide. Coming out of the vendor survey, 57% of the vendor respondents reported their solution does not integrate with Commonwealth portals. That's sort of not a surprising figure given the information in interfaces available. We believe that's an area that we can work with vendors, service vendors and the government. It was also reported that only 33% of industry organisations indicate one holistic consumer record. So again, we're looking at that interoperability. And further to that, only 5% of industry providers indicated that they integrate with the My Health record, with 73% of service providers not knowing if their consumers are actually using the health record, so there's opportunity there. So within our next call to action is to work with the council looking at those business to government, My Aged Care and CRM opportunities, looking at the business to government and API portal, so basically consolidating all available APIs from the various vendors, looking at what business to government quality indicators and API information things that we can do, and looking at how we can streamline the business to government DEX processes, and also looking at the various ways we can do consumer records in those various system integrations. Thank you.
Thank you, Gavin.
Thank you, George.
Thank you, Gavin. Thanks for that. Again, a very comprehensive report on what was a very detailed survey. And we will be touching on a number of areas going forward as well. Just a reminder again, any comments, statements, questions, please use the Q&A panel so our group of hardy volunteers can answer you in the near future. And we'll move on now to Rod Young. So Rod Young chairs ITAC, the IT and Aged Care Committee. Many of you would have attended that event over the years. And Rod, would you like to let us know about what's happening in the future with ITAC?
Thanks, George. Yes, in the age of COVID, we are planning the next ITAC event, which will be held in Sydney, 10th and 11th of March at the Rosehill Racecourse. And one of the reasons for going to that particular venue is that it is a very large venue, and we can meet the space requirements if we're still in a situation of 4 square metres or 1.5 metre separation, both in the exhibition space and in the conference hall space. The theme that we've chosen for this year is transformational change, and in part the committee, which is a nice solid cross section of both provider representatives from ageing and disabilities and vendor representatives, is transformational change represents, we thought, the state in which we exist at the moment, where technology is in part being driven by the pandemic and the need to respond to that in the most effective way possible. Shortly, thanks, Georgie. Shortly, we will be moving to the calling for abstracts, and abstracts is part of our regular ITAC events, and we go out to the industry across a broad spectrum looking for papers to be submitted by interested parties to provide a range of perspectives of development and change. Some of our topics this year will be innovation in the time of pandemic, cybersecurity, aged care and disabilities royal commissions, telehealth in aged care, assistive home technologies, care recipient independence through technology support, use of big data across care service models, reviewing the potential role of blockchain in health and care systems, the role of digital assistants in care systems of the future, and the use of CCTV in critical service industries and the privacy implications flowing from that. The call for abstracts will be opened on the 23rd of this month, and there will be a fairly extensive period for those who are interested in submitting a paper to submit their abstract. The call will include a fairly comprehensive description of the format, length of applications and supporting materials to be lodged. Similarly, we have run for many years the ITAC Awards, and we'll be opening those up for submissions from the 29th of July. And they similarly attract a fairly broad cross-section of interested parties who have done or are in the process of delivering innovative solutions that are worthy of recognition and acknowledgement through the award process. Obviously, if you're not aware of ITAC, then the conference outline and contact details is available at itacconference.com.au. As well, that'll also take you to the main site, and you can review earlier events, speaking programs, conference format, etc. Again, we will be looking for sponsorship and exhibitor engagement. That raises a range of possibilities for vendors and suppliers to the industry who wish to have an opportunity from the smallest exhibition space through to platinum, gold, silver or bronze level sponsorships. We are always looking for vendors and suppliers to be supporting the networking lounge, juice bar, coffee station, the conference app, delegate satchels, ice cream cart, lanyards. And in the context of our pandemic environment at the moment, we're doing a considerable risk assessment as to what we would do if, perchance, the event can't proceed on a face-to-face basis, or if we end up with a range of virtual and face-to-face delivery options. So we'll be exploring those. In fact, we've got a committee meeting on Thursday, and we'll be exploring those at some depth, but we're always open to any suggestions that vendors and suppliers may have to contribute towards how we develop and deliver on the most effective format for both the delegate attendees and for exhibitors and sponsors. And we have changed the format considerably over a number of years now so that we can respond to the changing need. In the context of what we are doing this year, we are looking at how do we actually have a mix of enhanced technologies to support people who may not be able to travel, but who wish to participate, and how we make as much of the conference available to them as possible. How we get as much integration in a technology supported way between exhibitors and participants so that we can match the interests of each and the opportunity for each to meet and to exchange their interest and their opportunities for further dialogue. I think that wraps up for me. Thanks, George.
Thank you, Rod. Thank you for that. And yes, everyone get those dates into your diaries from now. ITAC has been the premium event for aged care industry technology for the last 10 years. I think next year's will be a great example of how we actually integrate the post-COVID environment of use of technology into the conference events. And all of us have been quite active over the last few weeks, reviewing the various technologies available to enable people to attend remote events. So looking forward to ITAC 2021, and it should be a great event. And if anyone has any suggestions, recommendations for how the event should go forward, the group involved in organising ITAC are open to suggestions. Before we kick off with Q&A, I'd just like to invite Robert Best, the President of the Medical Software Industry Association, to make a few comments. Rob, for those who don't know him, is President of MSIA. He's also the CEO of MIMS and has been very active in the industry for quite a few years. And the MSIA was a great supporter with us in our vendor survey. And it was also the ACIITC, which was the Aged Care Industry Vendor Association, was amalgamated into MSIA a few years ago to enable that to have a broader reach across the industry. So Rob, if you're available, can you say a few words?
Hi, George. Can you hear me okay?
We can hear you, Rob. Thank you.
Great. Hello to everyone, and thank you for the brief opportunity. Thanks for the webinar and the presentation. It's a terrific overview, and I think it gives all of us a good insight into what you guys have been working on, particularly given such a short deadline as well. Specifically for Anne's section, when she covered off the research around the Care IT project, you know, it's interesting to note there's 420 vendor solutions that are out in the aged care industry. And for us, for the MSIA, the Medical Software Industry Association, we have a number of those vendors that are members of ours. And so we will encourage them to continue looking to work with you guys and looking to work at how we can improve services and solutions. And particularly to Gavin's point, I think there's an interesting call to action there that I would encourage a lot of our members to get involved in. I think that, you know, aged care, particularly after the events of what we're experiencing here over the last few months, and the fact that we have aging populations, the fact that we will be under pressure in years to come, is almost a great opportunity, if I could use those words, for those in corporate or private enterprise to take advantage of what will be an industry that has to undergo change. So from our point of view, I just wanted to, I guess, share with you that from MSIA, we are very open, willing, and looking forward to continue to work with you guys, and would encourage our vendors to do so. So we'll be continuing to make announcements in our newsletters. And in my corporate role as CEO of MIMS Australia, we engage very actively with a lot of the members, a lot of the vendors that might be on this call, to continue to deliver drug and medicines information into that industry. So thanks very much, George, and look forward to hearing other Q&As. Unfortunately, I need to drop off for another commitment coming up soon. I do appreciate the opportunity. Thank you.
Thank you very much, Rob, and I appreciate the comments. Okay, so I'll now move on to Q&A. Unfortunately, Gavin seems to have fallen off our connection.
On, George.
He's back on?
Yeah.
Cool. Excellent. Okay. So, because a lot of the questions are focusing in around some of the technology aspects, we do have a very specific question, Gavin, so I'll get you to answer that one first up. What do you mean by a B2B API portal?
A suggestion has been made that all, I guess, a number of vendors indicated that they had APIs available. It's an idea to work with the council to bring all those APIs together so we can basically form a working group and share those to service providers and share those amongst vendors. So that's that idea about an API portal, centralising all of them into a repository so people have documentation, so organisations aren't out there reinventing the wheel, and there can be some collaboration between vendors as well.
Thank you. And I guess the other question people raised was, obviously there's a number of products. You did touch on it in your report, but can you just remind us again how many actual vendors were involved in the survey and leading up to that 420 plus products?
From the 420 solutions, they were represented by 139 vendors. 139 vendors partook in the survey, identifying 420 solutions.
Excellent.
And they were, I see a George question, they were unique offerings, 420 unique offerings.
Excellent. So obviously there's quite a scope of work there for us to better understand the scope of those solutions, and that's be part of the work going forward to have a, not so much a catalogue, but a better understanding of the range of solutions out there and how they fit into an integrated work environment. Cool. Got a question here specifically, and again, it's probably focused at Gavin. Has the technical committee looked at the opportunities for use of HL7 Fire in the industry, particularly with government, e.g. My Health Record?
No, we haven't had a look at it. What we did identify within the survey, and we're still going through the research process, is the various, like there's HL7 Fire and a number of other industry standards. From memory, actually, there was over 90 industry standards covering various aspects of data communication, nurse calls and stuff like that. So the answer is no, we're still going through those various standards that are being used, but we're hoping to form a working group around that.
Mm-hmm. And I guess a number of us have been involved in standards groups over the years. So I myself was actively involved with HL7 for a number of years. I know Anne's actively involved in a number of the standards groups. So working with the standards groups, and we may put it on our agenda to get Graham Grieve, the Australian father of fire, to come along to one of our next sessions to tell us a bit more about how fire may play a role in Australia for integration. So we've got quite a few questions here going through. To Rod, I mean, a lot of vendors are keen to understand how they can get more involved in ITAC. Can you give us a bit of a chat about how vendors can get involved both on the trade floor, in the program, and pursuant to ITAC, how the vendors can play a more active role?
Sure, George. Anybody interested, just go to the itacconference.com.au site and let Jane Murray, who does the conference organising, know that you're interested. Jane will shortly be releasing the prospectus for the next conference, which will include a diagram of the exhibition space, sponsor opportunities, exhibition opportunities, etc. And Jane will put you on our interest list and then communicate all of that information to you as soon as it's available in the next month or so.
Appreciate it. Thank you, Rod. Now, one thing both Anne and Gavin raised as major issues is cybersecurity, and we've seen that being raised a number of times over the last few weeks at a federal government level. There are a number of activities in place across the broader technology world around cybersecurity. Two questions, I guess. One for Anne, from a provider perspective, what sort of things do they need to get their heads around early on around cybersecurity? What resources can they access both within the council and externally? And for Gavin, probably a deeper technical dive. What are the guys and girls behind the scenes who are running the systems need to know, and how can we work closer together to enable an aged care, disability care, cybersecurity group? Over to you, Anne, first.
Thanks, George. He did identify in the report great vulnerabilities, and we need to work really quickly to ensure that the sector isn't as vulnerable as what we've identified. The council is meeting tomorrow to discuss its body of work for the next 6 months, and I know that on the top of that list will be a number of items around cybersecurity, where we do hope to do a national roadshow to provide both awareness raising but some resources to the sector. So again, we'd put out the call if there's particular vendors out there that want to work with us around that issue. We'd be very happy to do that, but our goal is to improve the level of compliance and also to raise issues with those who are perhaps new to the industry, the importance of that, and to develop some significant resources. Thanks, George.
Yeah, and Gavin, any advice for the technical people in the audience?
If I may add to that, like, we did look at malware, we did look at virus, we did look at firewall, and the uptake as a whole was actually quite surprising. So there's rooms for improvement there. Of concern, though, was also from a vendor perspective, we're also looking at the auditing ability and ability to trace consumer records around that security aspect. So thinking of the Royal Commission. So there's some areas of work there. So a solution, whether it be nurse call, software system, basically just having an auditing trail and basically what the security measures around that, and also just the encryption of data. There seems to be a bit of a lax mindset. So a lot of education to be done. As Anne identified, we are trying to put together a group to sort of target some of those high level items.
Thanks, Rod. Sorry, Gavin. We had a question specifically around the engagement with the government. So I'll kick off this, and then I'll get Anne and Gavin and Rod to give their feedback as well. Like I said, the government came to us back in March to look at a benchmark off of the industry status. As we noted, as Anne noted, that was pre-COVID, and yeah, we now have to define our world as pre-COVID and post-COVID. But you know, kudos to the department for recognising that the industry needs to play an important role in identifying the solutions that are relevant to the industry. And they did come to us, and they were very keen on us to work through survey tools with the industry to understand the challenges they faced. During the entire period, we had an amazingly collaborative experience. The government representatives and our team worked very closely together to ensure that we had access to the resources we needed to deliver on this project. So I do thank the department for their support and help there. And they were very open that this was all about understanding the challenges the industry faces going forward. This is a part of a forward-going agenda. So I think from our perspective, for those of us involved in the project, we appreciate the department support. Going forward, we're already in discussions for next stages. So this is not a published report which will sit on a desk and gather dust, or whatever the PDF equivalent of that is nowadays. But this is a report which is going to lead to action, and we are already actively working with various groups within the department to provide solutions to those challenges. This is not just a matter of documenting what's wrong. This is all about improving the system going forward. So, Anne, do you have any comments about the engagement with the government over the time of the project?
Thanks, George. Probably one of the best collaborative efforts that we've had. I guess the government noted the big job that they'd given us in a 2-month period to achieve this, and we relied heavily on them for data sources, and we had, as George said, a great team to work alongside. I guess it's important to note that we have been working with government for a long period of time on the co-design. We were very active in the co-design space around the improvements to My Aged Care. We hope to work further, particularly in the body of work that they're calling enabling capabilities in My Aged Care, which is commencing as we speak, and we're at the table talking to the government about how we can assist in that process, how this research might drive some of their improvements, and also the opportunities to bring those people who are interested from the sector. I think we've got over 300 industry players who previously put up their hand to be involved in those co-design groups. We've had representation across the range of service provision types. We've had representatives across the range of geographical issues for people in very remote regional and metro areas. And we've worked very collaboratively. I guess those new enhancements to My Aged Care are ones that we want to be critically at the table co-designing. And again, vendors have a large part to play in the solutions to assist this. So I hope that we get opportunities to cross-reference that. We are on Friday talking further with the department about what that might look like and how that rollout will occur. And we hope at our next national forum to be able to provide our roadmap about how that's going to occur. And we know that the department is using this report to drive some of their changes and to prioritise what might be approached first. So in terms of the recommendations, George, I see questions about the release of the recommendations. It's important to note that we are still working with the department around those recommendations, and we're about to go back to them with a priority roadmap about how to tackle each of those recommendations and when. So we hope in the next 6 months that you'll see each of those recommendations actually acted on. And I think that's a significant opportunity to improve innovation and technology within the sector.
Thanks, Anne. Gavin, a question probably for you. A lot of people were questioning from the vendors that were involved in the survey, what percentage were purely local Australian grown vendors? What number were from overseas, and what sort of range of vendor sizes and nationalities and geographies do we have?
I apologise, I can't quote exact percentage numbers, though we did have quite a, I don't have the numbers in front of me, we did have quite a diverse representation. So we did have some rather large international players who are on Australian soil. I think, as I was saying, we did have like the small startups from 2 to 1,000 plus organisations, with those people being around for more than 50 years. We had 1 or 2 organisations with quite sizable consumer and customer bases, also around the 100,000 mark. So it was very diverse, and very representative of the industry. Thanks, George.
Thank you. So actually a follow-on question from that, from the startup community in particular, they're looking at what funding opportunities, what support opportunities are available for aged care technology startups in this sector, whether the councils can play a role in supporting those going forward, any recommendations we have. One thing I will point out, the Australian Digital Health Agency recently ran an innovation program where over 400 vendors applied across the broad spectrum of healthcare. But the good news is, off those 5 that came out as the success stories, 2 of those are very specifically involved in aged care. So there are opportunities for at various levels to be involved in innovation in this space, and there is support from various organisations. The council has on its agenda a goal to facilitate that introductions to both funding and support opportunities, and it's on our strategic roadmap at a board level to provide tools for that. We do have in place currently our mentoring project, which is not limited to just providers, but is quite happy to work with across the sector with organisations who are involved in aged care technology. So the opportunity to receive one-on-one mentoring with people who have been in this space for a long time. But to Anne and Gavin, any other recommendations for how startups can access support going forward, not just financial support, but support for integration with providers, the ability to test their product in the real world? And like kick off of that?
Yeah, I guess throughout the research that we really identified opportunities for co-design. Co-design with both industry players and end users, the older people and their families, and communities. And I guess going forward, there are some recommendations in the report about how we might action a suite of co-design activities. So I guess for startups, watch this space. We're hoping to have some announcements shortly about collaborative activities that people could get involved in. We also work regularly and meet regularly with state and territory governments that are also very interested in this issue of the economic activity and potential that technologies for aged care, whether they be assistive technologies or technologies that drive productivity in services. The opportunities for Australia to lead some of those activities are clear and apparent, and I think some informed state and territory governments are taking that more and more up with their innovation and economic advancement strategies. But we also know other federal entities are really interested in looking at that. And I know also Isabel Friend's on the line today. Entities like the Digital Health Cooperative Research Centre is really looking for opportunities also to work alongside startups and more developed vendors. I guess one thing we also haven't mentioned, George, is our intent to mirror these activities on perhaps a yearly basis, which also will give a bit of a benchmark about how the sector is developing, growing, changing, whether we have resolved some of the issues. So for startups, following our research really also gives the potential of noting where the gaps are in product development, where there are opportunities to make a significant contribution to new products in the landscape of service provision. Thanks, George.
Rod, I mean, I know ACIITC has a strong focus on supporting new and exciting innovations. Any plans for 2021 to highlight and help the startup communities in aged care technology?
Thanks, George. Yes, the last several years we've supported a number of startups to have access to the exhibition space at no cost. This year we're talking to Care Factor, who some may have heard last year ran a very successful startup support program, and then ended the year with a finalists pitch session, which was taken out by Halo. We're talking to them about doing the same thing next year in conjunction with ITAC. Those discussions aren't complete as yet, but we're also offering the 10 finalists a space in the exhibition space at ITAC at no cost to the participants. So there are a number of things that are happening. There's quite a number now of successful startups. And anybody who's online who wish to have some referrals to various people, then please feel free to contact myself or George or Anne, because those people who have come through the system so far have been able to commercialise their solutions and develop their business opportunity within the industry already. I'm more than happy to help others who are in an earlier stage of development. So it's quite an exciting space, and I think we're all keen to help any new startups who wish to enter the industry and explore the opportunities. Thanks, George.
Thanks, Rod. Gavin, anything you'd like to add to that?
No, Rod, I've got a few, sorry, no, George, I've got a few connectivity issues, but no, nothing further to add.
Cool. Okay, so we've got a couple of questions coming up around the art research, and we did comment that Isabel Freen from the Digital Health CRC is online as well. And I guess that'll probably be yet another national forum where we're going to have some more detailed discussion around the research opportunities. One of the things we are working on, as was announced at the ITAC conference this year, was the Living Labs project, which is currently being set up. So that's one opportunity that will come into play. But we will have a number of research opportunities going forward. One question I have here, which was very specific, I'll answer now. Can vendors become members of the council? Well, the council itself doesn't actually have individual membership. The council is designed to represent the broader provider community, and we do have two of the largest peak bodies as our owners, essentially, as members of the board. But we are happy to collaborate and work with the broader community. So please be in contact with us. We do have a new LinkedIn group, which will enable us to have some more public discussions. But we really are working on how we can improve communications across the sector. So first of all, direct communications with us, and our contact details will be made available at the end of the webinar. Let's work collaboratively on what is the best way to have an open communications protocol. We've had challenges in Australia, and I've been involved with a number of technology groups in health and aged care over the years. How do we maintain the dialogue in between our annual events? These national forums are part of that, but I think it's really important that we actually have a continuing discussion, and in conjunction with the various other peak bodies in the technology space, MSIA, we're working with the digital health industry, the Australian Digital Health Agency, with the Digital Health CRC, with the new Institute of Digital Health. The goal is to make sure we have broad communication across the spectrum of stakeholders in play here. But specifically looking at the research agenda, we have one question. In the research, did we see a two-speed technology usage with any differences between not-for-profits and commercial providers in the use of technology in aged care? Probably run this over you, Anne.
That is one of the very areas, it's a great question, whoever asked that, one of the very areas that we're now endeavouring to drill down on. Our data in the report was provided in a sense at high levels. So the opportunities to further this work by drilling down those correlations and relationships between issues like that questioner asked is what we're embarking on now. So I guess we've got now a body of data, and we're looking at the opportunities to further drill the relationships between that data. So that is exactly what we're working on now with the department.
Gavin, any comments to that?
No, nothing further to add, George.
I guess we can comment that, you know, I presented in my slide a huge divide between those who are digitally mature and have their systems in place, their investment strategies in place, their commitment to innovation, to improve practice, to improve workforce, to improve the impact that they're delivering to older people, to those that are very much starting or not even on that journey. And I think size did matter for some of those, but size didn't also matter. Status did matter, and in the other occasions didn't matter. So what we're hoping to do is working with our data scientist colleagues who joined us on the expert reference group to further analyse some of this data. And it gives us also the opportunity, George, to I guess review our survey techniques and approaches. It was a very big commitment on behalf of service providers and vendors. Gavin can probably quote the number of questions. You know, we asked a lot of questions, and what our ambition is to drill down on the data we collected and ask fewer questions that really give an inside picture to what's happening in the sector. And again, we want to benchmark this year by year. We want to see if there's improvements. We want to review our priority areas. And this gives us an opportunity to either do that in whole or in part with issues that might be of concern. And I know that certainly cybersecurity was one of the big key issues that going forward, we'd want to see if there's, you know, marginal or great advances to improvements there.
One thing we did do in the report is use a number of case studies of organisations that have done exemplary use of technology, and obviously highlighting those that have been very successful. And a lot of that was driven by the ITAC awards, which come out of the ITAC conference. So Rod, any comments on how the ITAC awards obviously give us an example of great solutions, and is there a scope for having a most improved option going forward for in the ITAC awards?
Certainly there is an opportunity. We update and modify the awards categories each year, George. So we have made a number of changes over the years and continue to do so this year. The awards categories are up on the website. I can go through them now if you wish, but there is certainly 6 major categories, and then an additional category where we have an ultimate winner. And the ultimate winner is not awarded every year. It's the judging panel determines whether one of the finalists is such a standout award that they should be recognised as the ITAC for this year. I think the quality of the awards over the years has actually changed considerably, and we are now seeing, I think, much greater responsiveness from the industry to endeavour to meet the criteria that each category requests. And I think people have got a much better understanding about what it is that the awards are trying to do, and that is to really be an exemplar of what's happening in the industry, and an exemplar of those who are leading the pack in delivering their solutions.
Thanks, Rod. We do have a question from Philip Robinson, a good old friend of mine who's been involved in the technology sector for quite a while. And it's one of those standard metrics that is often used in other industries. What percentage of revenue is spent on digital solutions by the aged care industry? Gavin, any comments on that? I think Gavin may have dropped off, unfortunately. And did we have any feedback on that from the report?
We did. I'm just trying to plough through the 414 pages to find that. Perhaps if you want to go to another question, and I might have found that for you directly.
Look, and I can probably comment on that on a qualitative and not necessarily a quantitative perspective. And again, our survey was a broad survey which looked at a number of issues. We did ask the question around technology spend. We didn't break it up very specifically into software, hardware, services, although we do have plans to go down that path in the future to get a better understanding of it. But, and I don't think anyone will be surprised by this, the percentage spend and the relative spend was still relatively low within the sector. A lot of organizations had one-off projects where they had a spike in expenditure, but what we did see across the spectrum was it wasn't built into the standard P&L of the organizations as in a big way. But it is going that way. So we are seeing a professionalization of the people involved in technology use within the organizations. We are seeing a need for more spend and better use of that spend. But I've got a comment here. We've got the average is 2.28%. But again, the heterogeneity of the market is the really big thing here. Some people were spending a lot more, some people were spending a lot less. And one of the key things we want to do from the council is to provide support for efficient spending of that money, because we all know going forward that funding is an area that we're going to be challenged with. So developing a framework for the efficient spending of the money, and also for a sharing of knowledge across the sector. The sector really is heterogeneous. We need to be able to support each other. Georgie in the background is doing a great job feeding me more details. The minimum spend was 0.02%, which I think basically means they bought an iPad for the whole organization, and the maximum spend was 10.8%. So we had a strong heterogeneity there. Anne, any comments you'd like to add to that?
George, one of the other activities we do as part of the environmental scan is we looked at other industries at the range of investment, and we found that the range of investment in innovation and technology was around 3 to 7%, and that was validated by some recent research that we quote in the report. And we're certainly, as the figures that Georgie was able to quickly generate there, show that we're lagging behind other industries, and we can do better. So certainly we are talking to government as part of the report about what that investment looks like, what we should be prioritising in investment strategies. And we hope to actually have some better measures of that going forward with the work that the council undertakes.
Thanks. I think you see Gavin's back online. Gavin, you'd like to comment on that? I don't know if you caught that, but we're talking about the percentage expenditure on technology in the industry.
So I don't know. So the range that came from the surveys, we saw that there's a spread between 2% and 9% of investment. So I guess, as Anne was sort of saying, there's a little bit more work to be done around deep diving into those figures. But those more innovative organisations sort of are above that 6% mark, whereas those 2% figures seem to be business as usual at this present point in time. But there's a bit more work to be done around those numbers.
Excellent. Okay. So look, I'm putting out a last call for questions because we are getting ready to wrap up, but we do have one question for you, Anne. I think you touched on this earlier. Out of the 5 areas that we looked at, which areas had the highest technology adoption in the industry?
Well, they all varied, I guess, George. And the
you commented that like the financial part of it, things were pretty well adopted, but some of the more innovative things are the areas that we still need a lot of work on.
Yeah, the research found that the major investment was in financial and payroll, and that we lagged behind the others. So there's a lot more opportunity, I guess, for investment across those more enabling assistive technologies than what we've seen. And I guess in identifying some of the barriers to adoption or to integration of those technologies, particularly smart home and telehealth, we should be also recognising more investment in those technologies. And I guess it's important to reflect on the research we did released last year about what the evidence is showing you that's impactful. It should really be driving people's investment and spending in this area. We've all seen agencies invest in some technologies that haven't done what they said that they would do on the label, or just haven't achieved the outcomes of improvements in quality, improvements in efficiency or productivity. And I guess with limited dollars, we all want to invest in the things that make the biggest impact. So we really do believe that this research, coupled with the publication we did last year, should actually inform that investment strategy going further.
Mm-hmm. Look, I agree. I think the roadmap, which came out in 2017, really does give us a focus on how we can introduce solutions into this space. We've had a number of people asking questions about things like collaborative research grants, and I think we will have an action out of this event to have a specific online event specifically looking at the research opportunities going forward and our work with the Digital Health CRC as it evolves over time and various other organisations. So I think we'll have a future session around that. I won't go into too much detail now. Do have a question here about workforce. What high priority areas should be for aged care tech from a medical perspective, and from a broader perspective as well? So from a medical perspective, the integration obviously with acute and chronic care is very important, and I think we need to work collaboratively with our partners in the broader healthcare sector. But the reality is, aged care is not just healthcare. There's a lot more to it. So, Anne, would you like to make comments about other workforce opportunities we have in the aged care sector beyond just clinical side?
Yeah, clear and apparent, I guess, because George, was the issue of digital inclusion of our workers, our direct line workers. But we also found that digital skills up the management line needed to be improved. So I think there's a significant evidence that the digital literacy of our sector needs improvement. And to me, that's the baseline of starting to improve the delivery. We also know that there are organisations that issue technology as part of their main toolkit. And we know that that's sometimes been demonstrated not to be utilised by workforce, because although they've got the technology, they haven't got the digital skills to impact. And I guess the great opportunities we've seen via the universal delivery of telehealth certainly significantly are being researched and measured, and provide great opportunities to improve the data that we've got and the opportunities to use that data, but also to improve the quality and consistency of what we can deliver, and certainly improve the delivery to 24/7 type arrangements, which we haven't seen mainstreamed in certainly in community-based care.
Yep, I think the issue of digital literacy of our workforce is really important, because as we go forward with developing solutions in this space, we really need feedback from people on the ground who are using the technologies or delivering the services to help us design new solutions. An old colleague and friend of mine, Eric Dishman, who many of you may have heard of in the past, used to say that the challenges we had here wasn't one of technology or of innovation. It really was a challenge of imagination about how we can use the technologies to provide relevant solutions. So by actually having a digitally literate workforce, we can actually have much better communication between the vendors and the technologists and the people on the ground delivering services to provide more effective solutions. One final question we'll try and sneak in before we have to wrap up. And we talked earlier about the research on return on investment. And return on investment is a many-faceted measure. any comments at this stage about which specific focus areas showed return on investment, or is there scope for much more work in this space? Probably start off with you, Anne.
Yeah, I think scope for much more work in this space. We're already talking, George, to some financial gurus about benchmarking some of the data that we've got in respect to the investment levels, but also in respect to the return on those investment levels. I guess it's watch this space. I think that it's a major area that everyone wants to get a handle on. I think some of the data that we've got now is very usable to progress that discussion. And whoever that questioner should perhaps drop us an email because that's certainly an area that we're very interested in pursuing more work.
Yep. And that is an area, like I said, we are both with our work with the CRC, but also with a number of other organisations, the idea of measurement of return on investments and the validity of those measurements. And it's not just a dollars and cents thing. It really is a greater social good aspect of what we do. So I think that's really important. So look, at this stage, I think we've got a few people sort of still starting to pop up with questions. Any further questions, please feel free to email them to us directly. We will do our best to get back to you as soon as possible with responses. Use our LinkedIn group, and Georgie, I'll get you to promote our LinkedIn group to the people who have joined the call after this event to make sure we have an open forum for discussion. We do plan to have future events. If you have any ideas for future events online or offline, please feel free to contact myself or the executive by email, and we will follow through on those. The goal is to really open up the communications channels. This is an opportunity we have once in a lifetime. To have a pandemic and a Royal Commission at the same time gives us an indication that something needs to be done about aged care. So we are the people providing those services. We need to play an active role in future development. I'd like to thank my fellow panelists, Anne Livingston, Rod Young, and Gavin Tomlins. I'd like to thank Rob Best for his comments. I'd like to thank everyone who attended today. Please keep in touch with us, work with us collaboratively to develop an aged care solution for Australia so that as we all age and we're looking after our aging family members, we have the world's greatest solution, greatest aged care providers community in Australia. Thank you, everyone.